Patient Portal is an online platform for tinnitus and hearing loss patients. In this video, I will explain how to use the Patient Portal, perform hearing tests, and benefit from consultation and therapy selection. On the Patient Portal, you can diagnose the cause of your tinnitus or hearing loss, consult the test results and type of tinnitus with a qualified specialist, adjust and start the therapeutic process for your hearing loss or tinnitus. First page of the Patient's Portal is used to create an account. In order to access the services, you need to fill in the data and accept the terms and conditions. Fill in the required fields and click the Register button. After successful registration, the system will automatically direct us to the Patient's Portal panel. On the left side, you can see a bar on which the available services are listed. If we want to perform diagnostics, we click the tab Online Hearing Test. After payment, the Diagnostic panel will launch. At the very top, there is a bar with icons that navigate us to the various functions of the Diagnostic panel. The first icon is the Help page, where we will find questions of interest and instructions for the online test. The second icon is the sound setting, in which we can calibrate the diagnostic algorithm. The third tab is the available tests. We can choose the type of headphones we will use. There is also a short questionnaire that will set up a decision tree in the system for even more accurate analysis and recognition of the test result by the system. When we click the Run Test button, the system will start the hearing test. The system will lower the sound intensity value using a descending method to see if we respond 3 times to the same sound intensity. If we respond to the first 2 later and the third earlier, the system will start the hearing threshold test again from the last response. The test replicates clinical standards, in which the hearing threshold is marked in the system when we mark that we hear the signal at the same sound intensity. On the bottom bar, we can see the percentage with which the test is progressing. Here, the second module of the tinnitus plasticity study will already be available. As with the first test, we click on the Run Test icon and follow the instructions we see on the monitor. Once the test is completed, on the top bar we can click the test result, which will show a graph of tonal audiometry up to 20 kHz long with the plasticity test result. The system automatically verifies and analyzes the test result, creating an electronic description of the result from which we can find out to what extent the auditory cells work properly, to what extent they are damaged, what the damage concerns, and how the cells died. Suddenly, gradually, the result of the test is sent to the email address. If the description of the results from the system does not satisfy us, we can use the option of purchasing a description of the results, which will be prepared by a specialist audiologist. After paying for the service, the audiologist will send a description of the test to the designated email address. This tab can also be used when we have already performed the test results and we want a description to be created based on them, and recommendations for the treatment of tinnitus or hearing loss. Another tab on the sidebar of the main panel is Diet. In the recommendations, we can get to use a specialized diet to repair the fibers of the auditory nerve in the case of hidden hearing loss or to mute the noise. In this case, by clicking on the diet icon, we can activate access to materials, diet programs, and receipts for applying a diet that will lower tinnitus. Another icon is Individual Tinnitus Therapy. If the description of the test results shows that the diagnosed tinnitus requires acoustic stimulation, we can activate access to such stimulation here. After paying for the service, the audiologist will send us a special stimulation file to our phone that will serve to calm the tinnitus. The file is sent to an email address and is created based on the results of the test and the location of the tinnitus. Clicking on the Training tab will give access to videos on how to perform eccentric, isometric, and concentric training to reduce tinnitus.